You are an FI1 caring for a 24-year-old woman who has been admitted with a broken arm after falling down the stairs. She asks you not to let her boyfriend know that she is in hospital because he will be angry with her for being clumsy. Later that afternoon, one of the nurses approaches you and tells you that there is an angry man on the phone claiming to be your patient's boyfriend and demanding to know what her current medical plan is. He is threatening to come to the ward immediately and trash the place if you do not give him the information he wants. Rank and order the following actions in response to this situation. 1 equals most appropriate. 5 equals least appropriate. A. Call the police. B. Hang up the phone and call security. C. Pass the phone over to your patient so that she can speak with the man and diffuse the situation. D. Speak to the man, apologize, and calmly tell him that you are not allowed to give out any information over the telephone without your patient's permission. E. Ask the patient if it is all right for you to tell her boyfriend that she is well, so that he doesn't worry. Answer: DECBA. The best response, D, is the one that attempts to diffuse the situation by apologizing and calmly describing that you are unable to give the man any information, as this would involve breaking confidentiality. The next best option, E, is to revisit your patient and tell her that her boyfriend is on the phone. Clarify whether she would be happy for you to explain that she is well, so that he doesn't worry, or whether she really wants you to say nothing at all. Option C, although unfair on your patient, as it would put pressure on her to engage in a conversation that she would probably rather not have, would be the next best choice, since it attempts to address the situation directly. The question implies that there may be some domestic abuse occurring, and your patient may wish to shelter in the hospital and not be faced with her violent partner. The next best option would be to hang up the phone and call security, but this would be likely to anger the man who is threatening violence against the hospital. You have a responsibility to all of your patients on the ward, and you need to do all you can to calm the situation down rather than risk escalating it into a potentially dangerous situation. The least appropriate option would be to call the police, as it would be difficult to explain the situation to them without breaking the confidentiality of your patient. You are the FI1 on call for neurosurgery. A nurse asks you to review a patient and to deliver the intraventricular antibiotics that have been prescribed to them. You have never seen or done this before, but the nurse tells you that it is easy. You simply inject the antibiotic solution into the line that has already been sited intraventricularly. You attempt to call your registrar for advice, but he is stuck in theater with an emergency and say he will be several hours. The patient in question is very unwell, and you don't wish the antibiotics to be delayed any further. Rank and order the following actions in response to this situation. 1 equals most appropriate. 5 equals least appropriate. A. Call the on-call consultant for advice. B. Ask the on-call general surgical registrar for advice. C. Search the internet for information about how to deliver these antibiotics, and do it yourself. D. Write a message on the evening handover board instructing the FI1 on nights to speak with your registrar regarding the antibiotics once he is out of theater. E. Perform the procedure under the nurse's guidance, since she said she has seen this procedure done several times before. Answer: A, B, D, H, E. This question assesses your integrity about knowing when you should not perform a procedure that you have not been trained to implement, unless the situation involves life and death, and doing nothing would undoubtedly be catastrophic for the patient. You should not perform procedures that you have not been satisfactorily trained in, because you could potentially cause serious harm. In this example, in fact, it is vital to draw off the same volume of cerebrospinal fluid, CSF, as the antibiotics, so as not to cause raised intra-cerebral pressure. If you had performed the procedure without knowing this, the patient could have come to serious harm and be much worse off than they would be if there was a delay in their treatment. Asking an experienced clinician, such as a consultant, if they can come to assist you with the task, or at least tell you how to perform the task in detail, will be the safest and Best option in this case. Option B is the next best option, some general surgeons will have experience from their earlier training in neurosurgery and might be able to assist or advise. Option D, to leave the job until the expert is able to give advice and supervise, is the next best response, as it is better than performing the job yourself with potentially inadequate advice from the internet or nursing staff. Of the two final options, option E is better than option C, as a nurse may well have seen this procedure several times and know exactly how you are supposed to do it, whereas information on the internet may be much less reliable.